Hello and welcome to our fourth Medi Talk. And my name is Shubhra Bhattacharya, currently holding the CEO and the founder post of Make Medical Easy, a non-profit organization led by medical students across the various states of India. And today our focus will be the INICET exam. Why INICET? Because here I am very delighted to welcome our speaker, a very well-known Dr. Amartya Sengupta, who got the rank 1 in INICET 2021 and passed from Medical College Kolkata. Welcome and good evening, sir.
Hello, Shubro. How are you? How is everybody? Everything's all right?
Yeah.
Yeah, that's great.
Sir,
That's
if
great.
you
It's
are ready for discussion, then
good to be here. Yeah, I'm absolutely ready. Let's go. Let's get done with the questions. Let's start.
okay.
So, let's begin with the first question.
Yeah, just give me 1 second.
All right.
First of all, very congratulations for
Thanks so much.
this marvelous result. And our first question is how you manage the time.
Okay. So, I would want to stress on the fact. Lay stress on the fact that you don't keep everything to be completed towards the end of your journey. Okay. Start early, plan early, finish the bulk early, and then when you're towards the end of your journey, towards the end of MBBS, during internship, keep only the minimal stuff which is to be revised and recalled, so that you can enjoy your internship. At the same time, you can put in a decent amount of study hours as well. So with that, you can easily clear your entrance exams and be done with post graduation. Okay. So I would say focused, very focused and smart study is the way to go to manage time. Yeah. So when to start preparation and how to prepare and best strategies as per you. I mean, don't think about like PG as as some sort of a burden. Okay, it's more or less it has become. I mean, we have turned this into a necessity. Like society has turned it into a necessity, which it actually is not. But since nowadays with with the competition and all, and in today's very fast paced world, PG has become important. So don't don't waste your MBBS thinking about PG only. Okay, enjoy your MBBS and focus on your profs. Okay, I would say focus on your professional examinations. I mean, don't cram in order to pass. Okay, I mean, yeah, definitely that is the ultimate motive. Then that should be the ultimate motive to pass and get a good score. In your professional exams. But at the same time, make sure that you retain something as cross over to the next year. Retain the basic facts, retain the basic things which you should be knowing as a doctor. After your 5.5 years maybe this is over. Just try to retain those facts and those basic concepts and all. So I would say just there is no hard and fast time to start preparation. Just be sincere and be meticulous with every year of your MBBS journey. And if I had to say specifically about PG preparation, because it's not just about reading, it's a bit of other tactical work and all, other strategic work and all. So for that, I would say start after you're done with the final MBBS examinations. Okay, before the start of the internship, just chalk out your entire plan, and again try to stick to that as much as possible. But during your duty hours, please don't study during your duty hours. Try to appreciate your internship, try to enjoy internship, and try to learn during internship, because I think that is the most important part. Because at the end of the day, we'll all be clinicians, we'll all be doctors, and we are learning to be a doctor, not just to clear an entrance exam. So that should be always kept in mind. So I would say, yeah, just don't focus specifically on PG right from the start. Just focus on your on learning stuff right from the start of the MBBS. And as the days go by, start seriously thinking about your PG preparation. I mean, you can say take a step, choose a platform maybe when you're in your pre-final year. Okay, and then go for that. And again, this holds true till 2022. I'm not sure what next is going to bring, and for that, I think it should be a separate discussion, and that should be a bit more detailed discussion about how you should approach next. But as of now, till 2022, I think I would say choose your platform maybe in the pre-final year, and then clear the notes, make the notes ready, focus on your props, and after you're done with your props, after you're done with your final year, go to start an internship, chalk out your entire strategy, and start revising the notes along with try to enjoy internship at the same time. So that's that. To the next question. So did I focus on my semester and MB marks, and or were I just or was I just studying enough to pass it off? Well, personally, I have a few principles. I believe that whatever you do, you should be more or less good at that. Okay, more or less try to be as good as that, as good as possible, that as meticulous as possible. That's just my view. So I would never just study to pass. Before, 2 months or 1 month before the exam, definitely that is the main motive. We have to pass. That is the ultimate aim. Okay, we have to pass. But at the same time, try to add something else to that basic passing criteria. Okay, so I did focus on my semester because, like, if you read well during the semester, you will be well prepared at the end of the year, and you won't be in a hurry to finish the syllabus, and you won't be under stress of finishing the syllabus. You can take it easy, take things slowly, and sort of just to you can stay calm, stay focused, and not get unnecessarily worried. So I would say, yeah, I would definitely, I definitely did focus during my semesters. I made sure I got decent marks in my MBBS marks. In my prof results as well. But again, these marks are not very much significant unless you want to pursue house stewardship. Apart from that, MBBS don't really hold much value, except for the fact that you get to learn during the course of your MBBS. That is the only note. Okay. So yeah, I did focus, and I think you should too focus on your semesters as well, because by way of doing that, you will be ready for your professional examinations as well, and it won't be difficult for you to clear the exams. So that's it. Next question. Okay, so there are so many resources, and how to utilize that. Okay, and should we make combined notes from all sources, or should we add extra points after solving the entire GT student notes? So to give an answer to that, I would say, listen. First of all, focus what your college is teaching you. Focus on the PDFs which your college professors provide you with. They're from standard textbooks, and definitely, what if you read that, you are more or less good to go with the particular topic. Apart from that, nowadays with so many platforms available, I would say stick to one platform. Okay, stick to one particular platform. So far as the content is concerned, what I did, like personally, if I would say, I was personally a foundation student of DAMS. Okay, so 2 years of that, I followed it up with a testing discussion. So for content wise, primarily my source was, I would say, DAMS, but I did give tests from all the other platforms. In fact, I am a person who, personally, I like to test myself every now and then. So after the test series of the other platforms, and each and every single one of them, they're absolutely brilliant in their own way. So overall, I would say stick to one particular source for content, and you can, use other platforms for testing, because tests, you can give unlimited number of tests. Planned periodic tests will definitely help you. Will help you in the long run. And definitely keep your notes to a minimal. Okay, just don't scramble and just run after multiple sources. Just make sure that you have all of the important basic stuff and a few extra stuff compiled in a single site, so that it becomes easier for you to revise. Okay, I personally speaking, I am not much of no, I don't make much of my own notes, but whatever I do, I make sure that it is concise, and I make sure that it benefits me. So make sure that your notes are concise. Okay, make sure that the essential stuff's there in the notes always, and you can add a few more stuff here and there in the same notebook, or maybe you can keep a separate notebook for adding bit of extra volatile stuff. That, but again, try to keep it down to a minimum. Okay. And yeah, you can add extra points to GDs, but nowadays there is this option of bookmark as well. Keep your bookmarks to a minimum. Yeah, keep your bookmarks to a minimum. Okay, but at the same time, you don't have to write everything to the GTs, but you can include quite a few important stuff which you find that you don't know to your notes. But I would say keep a combination of a minimal amount of bookmarks and add a few important points here and there to your notes. Okay, so again, keep it compiled up in a single place and keep it precise. All right. Next question. Okay. Now, how to prepare for next in third prof part one? I would say, like this is completely new to me. I would, give my 2 cents on this. So first of all, I would say next part one. It consists of all the subjects, I think, and it's an MCQ based subject. So I would say like in Prof part one, you have only 3 subjects like I, Optha, and Optha, ENT, and your ComMed. So I would say start early and finish these subjects off. Okay, just finish these subjects as quickly as possible early in the year. Okay, because there's I and ENT, they're small subjects. ComMed is a bit vast, but you don't have to read the entire part if not possible. Just go for whatever notes you have, whatever other short books you have. Vivek Jain sir's book is again I guess it's still very very concise. I would say exam prep manual. I used to follow that. I mean when I was in your third prof one. Along with that, I used to follow Dr. DK Taneja's book. I mean, again, these 2 books, along with your class notes and whatever other sources you might have, is sufficient for your community medicine. So try to finish. These 3 subjects as early as possible, I would say. And after that, you have a decent amount of time to focus on the MCQ parts, focus on the past year subjects, focus on um, uh, whatever is coming. Whatever's coming next. Try to start with your final year subjects. You can start with small subjects. You can start with pediatrics. You can start with gynecology, obstetrics, and definitely you can start with your the basics of medicine and surgery. So finish your subjects. Third MB Prof one subjects in maybe like in the first 3 months. Okay, if possible, like 3 to 4 months, no issues. It's not a hurry. Okay. After that, maybe devote a couple of months to starting with your final year subjects, or maybe revising just a couple of practical subjects, whatever suits you best. And then again, before the prof, just before like 1 month before the prof, just focus on your part one subjects only, and then move on to your final year. And in final year, focus on the final subjects very very carefully, because I think that's the massive chunk of the massive chunk of questions will be coming from your final subjects only, because after all now things will be integrated, so you will find you'll definitely find your final subjects almost in every question. Okay, so focus on them. And then how to use online coaching. Again, it's subjective. Okay, if you're somebody who likes sit at your home and you feel that it's comfortable for you, go for the online apps. Again, now in today's day and age, almost every single platform has online coaching. Dams has online classes now. Maro is always online. Google is also an online app. They're all excellent. Okay, I would say personally, I was a dance student, so that definitely benefited me very well. And I got also benefited from the other platforms as well, giving the tests. So I would say again, it depends upon I mean, uh, you personally, what you feel to be more comfortable. Just go with that and stick to that. Okay, stick to the particular platform for content for whatever they teach you. Just stick to one particular platform. Okay, try to avoid confusion. Stick to one particular platform for your content, for your notes, we say, and you can use other platforms for tests. There is no issue with that, absolutely, because I have personally done that. And how to retain concepts longer and more efficiently. I would say try to understand the basics behind it, why one particular thing is happening at first. Okay, and then make sure that you don't forget that, and thereafter you slowly you try to revise as per your convenience. If you find that there is one particular topic which you find that it is very volatile, you're forgetting it in maybe I would say 1 day or two. I would say revise that particular topic every 3 days. Personally, I used to do that. Take out some time, take out maybe 1 hour to revise your volatile topics, revise them every third day. That's what I used to do. And so yeah, that will jog your memory all the time. So ultimately, there will be one point then things will become spontaneous, and you don't have to actively make a recall, actively make an effort to recall stuff. So that will have definitely. I would say do try the every third day plan of revising your important. I mean your volatile or easy to forget topics, and that will help you to remain in a bit for a consistent period of time. So next question. Okay, how to approach medicine as a subject from third year part one? Like in Bengal, we have this concept of HIP, okay, like where we go to senior PG, dadas and they teach us. Senior, third year residents, second year residents, they teach us about medicine, about the cases, about how to present a case clinically, and also related viva to that. So definitely don't miss out on that. Go to your wards. I would say start going to the wards from your third MB part one itself. After you're done with your third MB part one subjects. I would say keep 1 day, maybe 1 day or maybe 2 days in a week in the evening after you're done with your college. Relax now. You can go to the medicine wards and you can contact your seniors and they will teach you. So definitely keep that as an option, and you get to learn a lot when you are in your wards. You first of all get to do the clinical examination, because I feel medicine as a subject, the theory is okay, you can read the theory, but if you don't touch the patients, if you don't look at the patients, if you are not there in the wards itself, if you don't you're not being helped out by your seniors as to how to present a case, as to how to examine a particular system, I think it is very difficult. It becomes very difficult at the end when you're about to appear for your final prof. So I would say definitely take the time, make the effort to go to your wards and talk to your seniors, ask them to teach you the techniques of clinical examination, focus on the systems. I would say start with GIT, because that's what I did, because that is the most frequent case you will come across, DCLD. So focus on that, focus on GIT first, and then switch to, I would say, after GIT, go for a CVS case, then go for a respiratory case, and then go for a neurology case. So this is the sequence you should follow as so far as learning in the clinical wards is concerned. Okay, so and that's that. And also one more thing, there's one question about the books you should read. Personally, I for theory I used to read I used to read Dr. Archit Balur's book, okay, and along with that, a bit of Davidson maybe. And I used to read my notes, my dance notes, whatever notes I had. And apart from that, for the practical part, I think that is the most important part, because in West Bengal per se, the massive chunk of marks, is devoted to your practicals, and it's also a bit difficult to clear your practicals. Actually, I would say it's very stressful. So I would say follow a standard, clinical examination book. We follow Arup Kundu. Okay, so I think that's a very good book for passing. It has all the questions and answers you need to clear your viva. And for examinations per se, I would say keep McLeod with yourself, or maybe Hutchison. I mean, Neuro is very good from Hutchison, and for the rest you can go McLeod, and for your viva you can go for Arup Kundu. Okay, so these are the books which have to be read during your final year. And currently people are using Kumar and Clark and all, but again, use that to your own convenience. See whether you can finish the textbooks or not. Okay, base that up in your own convenience. Keep things to a minimal. Go for your notes. Go for a standard textbook like Orchid Buller or Davidson, and go for your clinical examination. I would say. Next question.
Thank you so much. So, one student from second year or third year, should
Yeah.
him or her start their medicine reading from textbook, or they can wait for final year?
I would say start reading from start reading the clinical examination part. I would say start with that. That would actually help you. The theory. Again, if you are interested in next, I would say just read the notes. Start with the notes. Start with the basics. Okay, and corroborate that with your textbook initially. But at least if you can't start with the theory, I would say just start with your clinical examination round. Okay, like It is clearly mentioned how to examine the patient. You start with that. Start with your clinics. I would say that is more important than reading a theory per se. Okay, start with your clinical books.
Thank you.
Yeah,
So the next question.
yeah. How different is preparation for NICT than that for NEET PG? I would say like for NICT per se, if you must go through the past papers. You must go through the past papers because they repeat a lot of topics. Okay, that is the most important part of an INICT program. I mean exam, because this time also they repeated. I guess 40 odd topic repeats. That is huge. So definitely don't miss out on your past papers. That is the most important part. And also they they focus on your clinical. I mean the clinical aspects. What all you learn in your internship. So definitely focus on your internship very well if you want to clear your INICT, because they ask routine stuff. They ask the size of cannulas which you use all the time. They ask for green and pink cannulas. They don't ask for anything else. So basically, they ask very practical stuff mostly. So definitely focus on the past papers. That is the most important part for any. For appearing for any INICD exam. And for NEET PG, I would say just focus on your basics. Just don't do anything different. Just follow your schedule. There is not, absolutely nothing extra to be done to crack your NEET PG, I would say. So there is, all in all, if you are well prepared for INICD, you will crack NEET PG. If you are well prepared for NEET PG, I would say just add your past INICD papers to your repertoire, and then you're good to go for both.
Thank you so
Okay.
much.
Yeah.
Okay, so the next big questions.
Okay.
What is your
So
opinion
what
for
is your?
standard textbooks?
Hmm. I would say, yeah. I mean, standard textbooks are, I would say it's very difficult to read standard international textbooks per se, but you can definitely go for your Indian authors. They are very well concise books. Like, for example, go for DC Datta for your obstetrics and gynecology, and go for Arup Maji sir's book for your practicals. For pediatrics, I would say go for Dr. Obigai's book, and for your practicals, go for Dr. Shivaji Ghosh's book. He was our HOD in Medical College Kolkata a couple of years back. So his book is excellent, I would say. And for surgery, go for Isha Sir's book along with either Dr. Makunlal Shah's book and Dr. S. Das's book. I would say personally at MBBS level, just know the points of examination from Dr. S. Das's book, and for the rest, definitely Dr. Emal Shah's book is the best when it comes to appearing for your vivas and all. So these are the basic Indian books. These are also standard textbooks, mind you. Definitely don't miss out on them. I would say start early again at the initial phase of your preparation. Go for these books when you have time, read them properly. And when it comes to international textbooks, I would say, just keep them to a minimal. Okay, just use them for your reference. That's all. Just ask your seniors or ask your professors what to read from them, and just focus on that only, because you don't have to read the entire thing. It's very difficult for you to finish them up. And don't bang your head on these books. You will eventually read them when you're in presidency. So there is no hurry. Okay, there is no hurry at all. So just keep things to a minimum, and try to keep things under control. Okay, as much as you can read. So just do the bare minimum from those international textbooks. Okay. And if yes, how many questions were asked which could have been solved only by standard textbooks? Okay, for the INICET paper, mean, almost I would say 70 to 80% questions you can answer with your knowledge from MBBS only. And for the rest, these are high end stuff. For that, you need to apply your concepts. Those are extra edge things which you'll definitely learn with your coaching platforms. So there is nothing to worry about. And what other textbooks do you suggest for preparation? Again, okay, so I'll tell you what all sources I had used during my MBBS. So I'm naming all the subjects along with the textbooks, okay, which I read. So in first year in anatomy, I mainly read Dr. A.K. Datta's book along with B.D. Chaurasia. And That's all. For physiology, I read Dr. Devashish Pramanik's book. I think that's the best book in physiology you can have, because it's so concise, it's so easy to read. Along with that, I had Ganong, so I used to read high charts from Ganong. And for biochemistry, I had Harper, I had Vasudevan, I had Lippincott. I used to read Lippincott along with Dr. Vasudevan's book. And for particular things, for molecular biology, I used to read Harper. And apart from that, when it comes to the second year for pharmacology, I read no, Shanbag and Dr. K. Tripaঠি's book. That's all. I did not read any other book. And Dr. Govind Garg's, pharmacology review. I definitely read that. That is very, that's a very concise book to read, and you can use that for multiple visions. Pathology, I read Dr. Gitti's review of Robbins, and I also had Hirschhorn. I did not read Robbins. I just had the basic, the first edition of Robbins. I maybe read the first couple of chapters, the inflammation, the basic pathology from the general principles of pathology from Robbins, maybe. But apart from that, I focused on Dr. Gitika Khanna and Hirschhorn. These are the textbooks which I mainly read pathology. Then for FSM, I read Dr. Aryan Kamaka's book along with Dr. Agarwal and Dr. Reddy's book. I would say mainly Dr. Agarwal's book along with Dr. Aryan Kamaka's book. Okay, and for what's left? I think microbiology. So for that, I read Panikar and Dr. Bhavij's book, nothing else. That's all. And for parasitology, I read, I would say, I'm forgetting the name. I have to check. There are two standard textbooks. You can either go for one or the other. And if you want a concise review, I would say you can go for Nagoba. It's a good book to be read just before the exams. Okay, it's a very concise book, and you can finish it off before your exams. No problem with that. Then coming to your third MB part one, for I read Dr. A.K. Kurana's book, for ENT, Dr. Tingra's book, and for community medicine, again, like I said, Dr. Vivek Jain's book, along with Dr. D.K. Tan's book, and a bit of Park. So that was all. And also, I would say there is this book known as the Quest Review of the Past Year Papers. I definitely use that book in order to just get a glimpse of the past papers, and also get an idea about how to approach my answers during the examinations. Now for final year, I've already, I guess, mentioned all of the subjects already. So that's that. I would say these are all the books I read, and I did not, offer any hi-fi international textbook at any point of time during MBBS. So don't get all worked up behind that, because just take your time, just focus on what you have at hand, and you will learn. There is absolutely no problem with that. And is it
So,
okay to read?
yeah, any
Yeah.
book for the MCQ purpose or for,
I personally did
yeah,
not. Again, like I said, I used only Dr. Govind Garg's book for MCQs for pharmacology initially in my second prof, and I used Dr. Sakshi Arora's book initially for MCQs. But mainly, I focused on my notes and textbooks only. Okay, that was my primary source, I would say.
okay,
MCQs, I did not follow MCQ books much. Okay, because like nowadays, these MCQ books are sort of getting a bit obsolete, I would say, because you have your teachers directly in front of you and can interact with them in a one-to-one basis. So I think I did not lay much stress to the MCQ books.
okay,
Yeah.
okay. Thank you. So the last question: it is okay
Hmm.
read only the marrow or pre-bladder or DAMS notes to prepare for PG entrance examination, or it's necessary to go through textbooks also during the preparation?
I mean, you have already gone through the textbooks during MBBS, so after that, definitely you can't. I mean, you should definitely go through textbooks initially at the initial phase of preparation while you're in your MBBS, while you're appearing for your profs. After that, during internship, you don't have that much time to go back to textbooks. I would say your notes of DAMS, or maybe you were a MANO student, or maybe a prep ladder student, or maybe a Dr. Bhatia student. So focus on that during internship. Focus on the notes because they're crisp and they're very concise to revise. So initially during your MBBS, go for your textbooks. Later on, focus only on the notes from the coaching platforms.
Okay, thank you. দাদা একটু সরে এসো, তো মুখ দেখা যাচ্ছে না।
দেখা যাচ্ছে না?
হ্যাঁ, এবার
Okay,
ঠিক আছে।
okay. And now I'm done? Yeah. Okay. I get camera problem, I think.
Yeah.
Okay. Yeah, yeah.
So the next question is that,
How to start preparation for next. Also, how to study both for MBA exam and entrance exam as next to look up for internship. And how to retain concepts. I mean, I have already answered
yeah,
that.
yeah,
How to retain concepts efficiently.
yeah.
Okay. So,
So I want to add one question in that. So how to
yeah.
study focusedly in the time of internship?
Okay. I mean, during the time of internship, you won't get much time to just to open your textbook and just keep on reading, because I would say don't. I mean, never bunk your internship. Okay, you get to learn a lot. That is the most important. That is the beauty of internship. You get to learn a lot. You get to manage your ERs on your own. You get to sit in your OPDs. You get to look at patients, look at the treatment cards of patients, look at the treatment protocol of patients, look at the PhDs of patient. You get to I mean, in our college, we get to assist a lot of OTs. I mean, definitely don't miss out on that. Definitely don't miss out on the surgery experience. So I would say, I mean, to prepare per se, I would say focus on MCQs and focus on your volatile parts, focus on your concise notes during your internship, I would say. So, I mean, during internship, every day you will get like maybe 3 or 4 hours completely free. So
Okay.
definitely utilize that time to revise your notes initially, and then if you are unable to, open your notes, I would say whatever time you get, utilize that to do your MCQ, because MCQ revision during your internship becomes very important. Giving GTs during your internship becomes very important. Okay, give a GT every 2 weeks, and then sort of slowly increase the frequency to maybe give one GT per week and try to analyze that. Initially, go for the entire paper, the entire GT analysis, and thereafter gradually you sort of cut down on that and just focus on your rounds. So I would say that a combination of revising your concise notes, revising your MCQs, and giving your GTs would be the best during internship, during the 3 or 4 hours every day you will get after your GT is done.
Okay.
So
So
that is that, and yeah.
and when
Hmm.
one should start giving GTs? When he complete whole subject, or
No,
uh,
no, no.
yo,
Hmm. Yeah, I get it. No, no, definitely don't wait for that. Just start giving GTs after you're maybe done with maybe I would say 7 to 8 subjects. Maybe start giving GTs from that. Okay, that is a good point to start, I would say. And then as you complete your subjects, the number of corrects slowly it increases. Because why I'm telling you is that is because at I mean during your examination you have to go for educated guesses, you have to go for guesses, okay, because guesswork is maybe it contributes approximately, I would say, a meager 10% of the entire thing, but I would say definitely that is an important aspect, because you won't be knowing everything in the paper, so you have to make a couple of guesses. So try to improve on that, improve your guesswork. So that is the beauty of GPs. Okay, once you're done with maybe 8 or 9 subjects, start doing GPs. Try to improve your guesswork, and it will do wonders for you.
okay. So one should start their GTs when he or she complete your 7 to 8 subjects, as per you.
Yeah. I would say 7 to 8 major subjects. Okay, I
Okay.
mean may not even major, maybe just at least finish your maybe I would say final year subjects. I mean, it's not possible to finish medicine. Just have a decent idea about medicine. Maybe finish a couple of I would say second year subjects and then start giving. Okay, don't
Okay.
wait for and maybe a couple of short subjects maybe. So again 8 subjects and then you start. Yeah.
Thank you. So the next question.
Okay. What is the main source of reading? Is that dance class notes or manual? Again, like I said, I like my primary source. So far as notes is concerned, I would say I was a foundation student of dance, so that would be my main source. Okay, for the notes. And from Arrow again, I use the MCQs. So whatever new I found new whatever new content was there, I just try to just skim through that and add the relevant points to my notes, I would say.
Okay.
So definitely both of that help. And how to take arrange your main notes properly. Like I personally I'm somewhat of a very disorganized sort of a person. So my notes are horrible. My handwriting is horrible. I would say, like each and every single teacher of mine would testify to that. But I would say don't do that, because that becomes a bit difficult at the end, because you're sort of grappling with everything. If your if your content is sort of spread out, don't do that. Try to jot down the points which you find it important, which you find that you don't know, or whatever. I mean, jot down the basics on one particular notebook, as I've already said, and keep separate notebooks for separate subjects, I would say. So 19 notebooks for 19 subjects at least, and maybe nowadays we have this fancy term named 20th notebook. So that's basically nothing but a notebook where you keep your volatile stuff, so that you can just go through them just one glance before the exam. So I would say definitely keep your notes arranged properly and separately, well segregated.
Thank you.
Yeah.
Yeah.
And tips on how to prepare, schedule our time, and any engagement might help. So again, like I've already said, focus on your tests. Okay, like focus on the structure of the question. Read the first line, read the last line, read the options. You will sort of get an idea as to what the examiner really wants from you. Okay, that saves a lot of time, I would say. Then again, after that, once you're done with reading the options, just make a quick look at the investigations which they have provided, and try to find the keywords. Try to find the keywords. Try to find those particular words which will help you to identify the diagnosis. And that that comes with giving more and more tests.
Yeah.
And that's is an important tip I would definitely want to point out. Also, try to look at the structure of the question and the structure of the options. Try to rule out options on the basis of how it is structured. Okay, try to look for adjectives of very, of never. Of certain words like very, never, always, and exceptionally, and stuff like that. So try to find these differentiating points on your questions whenever you attempt to do these. Okay, so that is an important tip, because that is what personally I did to increase my number of correct guesses. And how to prepare, like I think I've already elaborated on that. Start
Yeah.
early, and make sure that your notes are ready, and then towards the end, just breathe, relax, and revise the notes slowly and steadily, and then keep on giving it things, I would say. Yeah, definitely that is the way to go. Okay, like how many honors and gold medals did I get? I mean, that is a bit. I would say these things don't matter. Okay, like these things matter. Like they will give you a morale boost. But apart from that, these things ultimately, in the in the longer scheme of things, they don't matter at all. They don't amount to anything. Okay, so personally, if you're asking, I had, I guess, 11 distinctions, and I had 5 gold medals. And from when did I start solving MCQs? Again, I would say towards the end of final year, after I was done with my final prof examination. And can GTs be given with the completing all subjects? Yes, definitely.
Yeah.
As I've already said, definitely it can be given. Just finish 8 subjects and then start giving the GTs. Okay. Yeah.
Okay, so thank you. The all questions are over.
Yeah.
And thank you so much for this nice discussion.
Hmm.
And any tips and tricks from your side?
Um, I would say definitely don't miss out on the chill factor. Okay, in your life, that is the most important part, because as doctors, we're always stressed out. Never get stressed out. Okay, that is the most important part. Take a break if you're getting stressed out. Focus on your hobbies. Talk to your parents. Keep your mind fresh. Okay, because mental health is the most important. If you're stuck with that, it becomes very difficult to move on. Okay, so again, treat your failures as, again, pillars to success. Okay, like uh, Rudyard Kipling's famous poem, "If." Okay, so treat success and disaster as two imposters. Okay, treat them just the same. So definitely, I would say, keep your mind fresh, keep your mind healthy. That is the best thing you can opt for.
Thank you so much for your valuable time. And what is your dream stream in future?
Uh, Dream stream, like as of now, I still have a dilemma between general surgery and neurosurgery. Okay, but ultimately, my ultimate goal is to be, as of now, to be a neurosurgeon. But we'll see to it what happens. Okay, so definitely I'll be going for surgery. Like there's no doubt about that as of now. Let's see if I can become a good surgeon or not.
Yeah, obviously. So thank you so much
Thank you so
and
much.
for this nice discussion, and all the best for your future life and future journey.
Thank you so much. Thank you so much. You take care as well. Okay, all the best to
Yeah,
you. All right. Thank you, everybody. Bye.
thank you. Bye bye.
Thank you.